Pat. Great to be here. And I just want to point out first, really to commend your leadership and all of the local health directors in the work that they've done in keeping us safe during this pandemic. I know that sometimes you don't get the credit that you deserve, so I want to make sure that that we say that here. And welcome the opportunity to talk a little bit about the variants and news that's been pretty prominent in the media lately. So I think this is certainly a note for caution. As you mentioned, our case rates have come down dramatically since their peak in November. However, we still have case rates that are twice what they were in the summer. And so we've not gotten back down to that level of transmission. And when we're starting to see these new variant viruses circulating in the US at a much higher rate, the most prominent variant that's been detected in the US so far is the variant from England or the UK. And so far, the CDC reports over 1,100 cases of that new variant virus have been detected in the United States. But if you look at some of the laboratory screening data, that would suggest that we've had maybe 100-fold more of those cases than have been officially reported. So we probably have had somewhere around 100,000 cases of that new UK variant, also known as B.1.1.7, in the United States. And the rate of that variant continues to increase, doubling almost every 9 or 10 days. And so by the middle of March, the US should have the majority of its virus as that B.1.1.7 variant. And that's concerning because it puts us in a position similar to where England or the UK was back in November, where they had dramatically declining rates, but this new variant was starting to take off. And by December, they essentially did a U-turn and had a huge epidemic wave that swept across the country in December because of that B.1.1.7 variant. It is considerably more transmissible than the old wild type virus, probably 40% more transmissible or more. And it also is more virulent. It causes more severe disease. And now that's been confirmed even as lately as yesterday with new data released from the UK. And so, as you say, this is not an indication or not a time for us to let down our guard. In fact, it's imperative for us to continue to work at all of the community mitigation measures that we've put in place, including being conscientious about wearing face masks, avoiding large gatherings, avoiding indoor dining and bars where people are inside without masks, and waiting until we can vaccinate a large proportion of the population. The good news is that vaccines continue to roll out across the country, and our pace of vaccinating is increasing both within the state of Nebraska and across the country. So a month ago, we were vaccinating 1 million people a day. Recently, we've been averaging about 1.7 million a day across the country. So this pace is increasing and will continue to increase through the spring and into summer. And at this rate, we should have enough vaccine and have vaccinated a majority of Americans by June or thereabouts. And hopefully we'll get to 75% vaccination rate, and then we'll really see case counts drop. Another piece of good news is that the vaccines that we're currently using, the Pfizer and Moderna vaccines, which are mRNA vaccines, appear to be quite effective against at least this new UK strain. So the experience of Israel, a country that's now vaccinated over 80% of its population with the Pfizer vaccine, recently demonstrated that the vaccine has 94% effectiveness in the population. And we know that greater than 80% of the virus circulating in Israel is now the B.1.1.7 variant. So the vaccines that we have work. They work against the new variants. They continue to show good safety profiles, and so would strongly encourage everyone who can get vaccinated to get vaccinated. But it will still take us several months until vaccine really has a big impact in blunting transmission. And so while we're doing that, we need to continue to be conscientious about all of the non-pharmaceutical interventions that you and all of our local health directors have been pressing for. Thanks very much.